This is Dr. Ara Deuk, and I'm here with one of my patients who underwent the Deuk laser disc repair. And this gentleman, how old are you, sir?
I'm 88 years old.
88 years old, all right? So for anyone out there who thinks that, oh, I'm too old and you can't do surgery, what do you have to say if you're old and you're fit and you want to live life and be productive? What do you have to say?
Be bold and do it.
Be bold even though you're old. Be bold and get it done. So the reason why we can operate on an 88-year-old person is he was in good shape medically. He was in great shape. And the thing about it is that you were trying to live an active life, and what was keeping you from doing that?
Well, my legs, the pain and the discomfort that I had in my back and my legs.
Okay. And so was that discomfort worse when you were sitting down or worse when you were up getting around?
It was fine when I was sitting down, but when I get up and walk, I couldn't walk but, 20 steps, and I was really hurting both legs.
Both legs. So
both legs.
We have a name for that. Medically, it's called neurogenic claudication. So he had severe neurogenic claudication, couldn't walk 20 steps without cramping in his legs and back. He'd have to sit down. So his life was being robbed from him. And then you have the Deuk laser disc repair to treat your spinal stenosis. Stenosis just means narrowing, and spinal stenosis means narrowing of the spine. And what was being narrowed were the little holes where the nerves come out and go down the legs. And so his nerves were being pinched by spinal stenosis. We offered him an open surgery with screws and rods and a fusion and laminectomy. He didn't want that. So we talked about laser surgery, and that's what he wanted to do. You had that 6 weeks ago.
Yes, sir.
And how are you doing today?
I'm doing great. I have no symptoms whatsoever when I walk.
You're happy?
I'm happy as hell.
So you get up, you walk, and you can keep going, and you're not having that aching in your legs that you used to have?
Nothing.
It's gone?
Gone.
Cured?
Mm-hmm.
Cured?
Mm-hmm.
Would you say cured?
Yes, absolutely.
Cured. So a lot of people don't understand the term cured. When I first started saying cured back pain, cured leg pain from pinched nerves, many of my colleagues thought I was crazy. You can't cure someone's back pain, they said, with surgery. You can't cure their leg symptoms completely with surgery. But yes, we get cures at Deuk Spine Institute. So what are you going to do now that your back is fixed?
I'm going to continue on. I'm going to play a lot of golf and do the things I used to do before all this happened.
I'm so happy for you.
Thank you, sir.
Anything you want to say to the world, people that are suffering out there?
If you got a back problem, come see Dr. Deuk.
All right, Deuk Spine Institute. I may not be here forever, but our knowledge and teaching and our understanding of how to fix problems will be passed on to future generations of doctors. Pleasure taking care of you.
Thank you, sir.
Go out and enjoy life.
Okay, sir.
All right, take care.
You.
Bye-bye.